Our next speaker is Dr. Katharine Clapham, and she will be speaking on what's new in my specialty in cardiology. There she is.
Thanks so much for the invitation to speak. I'm a cardiologist at the University of Utah, relatively new to Utah, but I thought I would show some good news and some bad news about living in Utah. This is a map generated by the CDC showing the death rates that are attributable to cardiovascular disease. And you can see that Utah is doing actually quite well compared to the rest of the country, although there's perhaps room for improvement if we want to compete with our neighbor Colorado, for example. And since it is a lifestyle medicine conference, I wanted to focus on how we can counsel our patients regarding diet and other recommendations that they frequently ask about. And we still stick to the advice that the Mediterranean diet has some of the best evidence for improving cardiovascular health. The Mediterranean diet includes a diet that's rich in vegetables and legumes, nuts, poultry and fish, and sort of healthy fats like olive oil. And it's been shown to lower risk for heart disease and diabetes. There was a sort of improvement on the Mediterranean diet called the Green Med diet that was looked at not too long ago, where there was a study of about 300 people who were at risk for cardiovascular disease. They had abdominal obesity and dyslipidemia, and they were put into three groups, either just sort of routine healthy dietary guidance, the Mediterranean diet, or this green Mediterranean diet. And the idea here was to increase the polyphenol composition of the diet, which is an antioxidant, and also to further reduce animal protein. So this was done by having people drink 3 to 4 cups of green tea a day, and then also substituting animal protein with a plant protein shake. And the green Mediterranean diet achieved pretty similar weight loss to the Mediterranean diet, about 6 kilograms, but was superior in terms of parameters like reduction in waist circumference, lowering your LDL, improving your blood pressure, lowering your high sensitivity CRP, and overall resulting in a lower Framingham risk score. So there might be some evidence to say that, we can do a little bit better than the Mediterranean diet alone. And there's been a lot of interest in the use of plant-based diets to improve cardiovascular health, meaning vegan or vegetarian diet. And there are a number of studies that have looked at this. One of the bigger studies was combining data from 5 different studies, and overall 76,000 individuals were included in this study, and they showed that vegetarians had 24% lower rate of ischemic heart disease and overall lower risk of death as well. Another big study came out of the UK, the EPIC Oxford study, again 64,000 individuals, showing lower mortality attributable to cardiovascular disease in the vegetarian group. And there has been kind of a longitudinal study out of the Cleveland Clinic that they started back in 1985, where they had patients who volunteered for the study that were interested in pursuing a plant-based diet. It was a pretty small study, only 22 patients. But they did some intensive nutritional counseling with them and then followed up with them to see if they were adherent to the diet. And they were also allowed to add cholesterol-lowering therapies as they became available. But in following these patients for 5 to 12 years, they noticed that they had improvement in symptoms of ischemic heart disease, and they did stress tests and also angiograms and showed that there was even some regression of coronary artery disease. So here you can see this is a coronary angiogram, and you can see that the sort of ratty, let's see if I can get this to work, ratty blood vessel the ratty coronary artery over here is restored to a more normal-looking coronary artery with improved blood flow here. So that was exciting and was expanded upon by looking at a bigger group of people, about 200 people, who were at risk for cardiovascular disease that had hyperlipidemia or diabetes. And again, they received intensive nutritional counseling. And the plant-based diet included whole grains, vegetables. They recommended that people take a multivitamin and a B12 supplement. And they were not allowed to eat, or encouraged not to eat, any kind of meat, so no fish, no chicken, no red meat, and they were also not allowed to eat sugary foods. So it wasn't just plant-based, but it was sort of a overall healthy diet in multiple respects. And the group of people that participated in this study were pretty adherent to the diet, about 89% adherence. And they showed that this is the outcomes for the group that were adherent versus non-adherent. And, the N, I think, is too small to make any statistical claims here, but they did show that in some patients there was symptom reduction from their cardiovascular disease, or even some reversal of the extent of cardiovascular disease. So plant-based diets are also a part of our recommendations for people that are looking for lifestyle changes that they can make to improve their cardiovascular health. And I would just say that not all plant-based diets are healthy or created equal. One could never eat a leafy green and still be on a plant-based diet. So I also think, we need to be realistic in talking to people about what they can do, and some progress may be better than perfection in that regard. So in terms of recommendations for exercise, I think I always tell people that if we had a pill that could do everything exercise could do for our cardiovascular health, that we'd be out of business, because exercise just has untold benefits. We keep learning more about them all the time. But the recommendation from the American Heart Association is that people should be getting 150 minutes of moderate intensity exercise, which they say should be 30 minutes 5 times a week, or 75 minutes of more intense aerobic activity like running or cycling and that kind of thing. And I think people are sometimes intimidated if they're not very active and you're asking them to be more active. They feel like they need to go sign up and join a gym and spend hours at the gym lifting weights or running on the treadmill. And I always like to tell people that what we've learned about exercise over time is that there really is this dose-dependent relationship with exercise, where even if you just do a little, you still benefit. So, doing more than you're doing now is better, and then you can continue to work on improving your physical activity. So this is a prospective study of about 5,000 men in the UK, and showing the event rate of coronary heart disease events as related to their self-described amount of physical activity. And so, again, you can see that even in the occasional exercise group, people had a lower risk. Had a lower risk, and that just continued to get better as people exercised more. There's another study from using the Nurses' Health Study. So this was 72,000 women in their 40s. This was back in the 1980s that this data came from. And again, they had people describe how much they were walking. And for the purposes of this study, they excluded women who were engaged in really vigorous exercise. So they excluded the people that were running or jogging or cycling regularly, and they just looked at people that walked. And again, they showed that there is this sort of dose-dependent relationship where the more METs that you walk per week, the lower your risk of coronary events is. And so even people that were not doing a lot still had a lower risk of coronary heart disease. And walking, I feel like when I say to my patients that walking counts, that often seems like a more achievable goal than maybe their conception of what exercise has to be. And this is from that same study, looking at the walking pace and how that related to your risk from myocardial infarction or death from heart disease. And they used sort of this easy, casual walking pace as their control. And they showed that if you walk a little bit more briskly, 2 to 2.9 miles per hour, you have a little bit improved cardiovascular outcomes. And if you walk even more briskly, it probably gets even a little bit better. So I think this is powerful information that, doing anything is better than doing nothing. And, over time you can work your way up to trying to get to that American Heart Association goal. But even just walking a little is an improvement. And I think the next speaker after me will focus more on this, but there's been increasing recognition of the role of our psychological well-being on our cardiovascular health. And the American Heart Association put out a set of guidelines to reflect the growing data on this topic. And essentially, we've learned that over time, we've learned that having negative psychological factors such as stress, anxiety, and depression are associated not only with behavioral changes and dietary changes that are associated with worse cardiovascular health. For example, people are more likely to smoke, people are less likely to get active, but also may have effects beyond just diet and exercise that increase risk for cardiovascular disease, and that conversely, positive psychological factors can be protective. And I thought this was pretty impressive. So this comes from that position statement from the American Heart Association. And they summarized, the studies that have looked at this and show that, for example, in individuals who have depression, there's an increased risk of heart attack, stroke, hypertension, and diabetes with a relative risk of 1.3 to 1.4. And similar sort of increase in relative risk for anxiety, work-related stress, PTSD, social isolation is an important factor as well. And people who have anger and hostility are also at increased risk, both of initial, development of incident coronary heart disease, but also recurrence of their cardiac events. And conversely, optimism is a protective factor. So people that were optimists had a lower risk of cardiovascular disease and also had improved mortality with a relative risk of 0.65. People that had a sense of purpose also did better. People that were happy or had a positive affect. And, there's also been literature on the use of mindfulness and its role in improving several parameters that are important in cardiovascular health, including BMI, fasting glucose, and how much you exercise. And there may be some confounders. There may be some confounders there with people that have the time or ability to practice mindfulness and maybe also have the ability to eat healthier or have more opportunities to exercise. So, it's a little bit muddy, but I'd say that it is compelling that there's kind of a consistent signal that multiple positive psychological factors are protective and multiple negative psychological factors are harmful. And along the same lines, I just wanted to point out that dog ownership has actually been associated with lower risk of heart attack and stroke. So there was a big study that came out in 2019 looking at dog owners and showing that it lowered the risk for lowered the risk for death in heart attack survivors. Especially, it seems to benefit people who are otherwise isolated or living alone. And I thought the AHA has adopted this data and other data into one of their position statements on pet ownership and cardiovascular health. And so there's a recommendation that, that basically dog ownership is good for your health, but they make a recommendation not to get a dog only for your cardiovascular health. And this is another study looking at just pet ownership in general, not just dogs. But this study was focused on looking at how people that have dogs increase the amount that they're physically active. So, part of the cardiovascular benefit of having a pet or having a dog might be that you have to get out and walk the dog. And so, as we know, walking is good for you, and that's maybe part of where this protective effect comes from. I thought this was an interesting study, again, not just looking at dogs, but looking at all pets, which included dogs, cats, and other animals. They took 48 volunteers who had hypertension, and then at the same time as they acquired a new pet, they also were started on lisinopril for their high blood pressure. And then they looked to see what happened to their blood pressure with stressful tasks. So they made them perform math problems, solve math problems, or do some speaking, and they looked to see how reactive people were in terms of their blood pressure. And, before lisinopril and pets, the groups were pretty similar. But after lisinopril and pets, there really was a lot less reactivity of the blood pressure in the people that owned pets. So they were less likely to have their blood pressure spike when asked to do something difficult like solve a math problem. So it might not just be walking, but there are these other, again, probably protective psychological benefits to having pets as well. And then I think it's important to remember the impact of our environment on our cardiovascular health. And air pollution is a concern, of course, in the valley here, as well as noise pollution and light pollution in our modern society. And this is a position statement about air pollution and its relationship to cardiovascular disease, just comparing several different studies that have tried to look at this. And they show that there is an increase in mortality, that it's related to the amount of small particulate matter from air pollution. And, the mechanism of this is not totally understood, but it's thought that these small particles may have effects on the vasculature, such as causing endothelial dysfunction or leading to platelet aggregation. And then there's might also be this systemic inflammatory response. It might affect our ability to store fat. So it's thought that the particulate matter might have sort of this multi-pronged effect on our cardiovascular health that we don't fully understand, but we know there's a relationship there. And over time, light pollution has become more of a problem. This is a map of light pollution in the United States starting in the 1950s and going through what it would be predicted to be in 2025. And again, we're a little bit more spared from the light pollution in the West than very highly populated areas on the East Coast, for example, but it's certainly changed quite a bit. And it seems that being exposed to light at night when it should be dark and you should be sleeping is related to coronary heart disease. And so the top part of this graph here is showing the attributable cardiovascular risk to nocturnal light exposure. And then when you add exposure to particulate matter on top of that, it compounds the effect. So both air pollution and light pollution are bad for your cardiovascular health. And I'll conclude with some optimistic thoughts in the spirit of maintaining positive psychology for our cardiovascular health, that again, I think we're lucky to live here in Utah. And so even if you know, I'm sure we can find air pollution and light pollution, but we also have the ability to get to places where it's incredibly dark. And this is Bryce Canyon, which has been celebrated for having one of the darkest skies in the U.S. So, and I'll close with that. No questions.
Do we have any questions?
It being Utah, do you have any comment on caffeine and heart disease?
That's a good question. It's a very muddy literature. I mean, I think there was some data saying that actually drinking 5 or 6 cups of coffee or more a day might improve your longevity. So I personally stick to the rule of moderation is key when it comes to caffeine. But I think there's kind of data pointing in both directions there.
How do you counsel patients who are adherent to a ketogenic diet?
In terms of whether that is protective from a cardiovascular perspective. So the ketogenic diet, there's also kind of a nice position statement from the American Heart Association comparing the cardiovascular benefits of different diets. And the ketogenic diet probably does have some benefit because sticking to any diet may lead to weight loss, which in turn is good for you if you're overweight. But of the diets that are out there, it is one of the less beneficial for cardiovascular health.
Just curious if you have any insights about weight resistance training versus cardio.
Mm-hmm. Yeah, so the guidance from American Heart is that, we should all be getting some aerobic exercise, the 150 minutes or 75 minutes of intense exercise. But they do suggest that we do at least a couple of days of resistance training to incorporate it as well into that.
Okay. Thank you, Dr. Clapham.